Pleural effusion. It is accumulation of excess fluid between two layers of pleura, parietal pleura and visceral pleura, two layers, and it is a complication caused by a number of pathologies that includes heart failure and pneumonia. The thing to be noted here is that there is always some fluid between two layers of pleura to save lungs from injury by friction, as lungs are always moving. It is only when an excess amount of fluid gets accumulated in pleural cavity it is regarded as abnormal. So how it would show up on a chest X-ray? This is a normal chest X-ray taken in a standing position, and if there was a pleural effusion, these are the areas that would show pleural effusion first: right costophrenic angle and left costophrenic angle. Again, this is because fluid is heavier than the lung and it has to fall towards the gravity. So these are the areas to first show effusion. Notice a very nice and sharp right costophrenic angle on this X-ray, and very nice and clear left costophrenic angle as well. If you look at this X-ray, the left costophrenic angle is blunt here. It is not visible. It is not as clear as it should be. So this patient has got a small amount of left-sided pleural effusion. Also notice there is an area of consolidation here, which is probably causing pleural effusion as well. Now this patient has got bilateral pleural effusion on both sides, on right side and left side, and the effusion is big enough to create fluid level here and here as well. If you look at the lateral view of this patient, you can again see two fluid levels which are indicating bilateral pleural effusion. This patient has got a huge amount of left-sided pleural effusion. Notice very nice and clear right costophrenic angle, but on the left side there's a huge amount of pleural effusion. More than half of the left lung is not visible. The whole hemidiaphragm, left hemidiaphragm, is not visible, including costophrenic angle, and there's a gap between rib cage and pleura here. This patient has got a huge amount of pleural effusion. I would like to thank Dr. Alex McLennan, who is a radiologist in UK, and at least one X-ray has been copied from en.wikipedia.org, a wonderful website, and the lecture is prepared for www.academyofprofessions.com. Thank you very much.